Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about bicep tendonitis and some of the treatment options that typically will help with this particular condition. But before I begin, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So essentially, bicep tendonitis is tendonitis of the bicep tendon, which is right in the front of the shoulder here. So your bicep muscle is the muscle here. The tendon essentially attaches right in the front portion of the shoulder. And typically this condition occurs with somebody who's done a lot of repetitive overhead movement. So typically this type of action or sustained overhead movements. And what will happen is after this particular, after it gets irritated, it'll be quite painful typically with again, sustained repetitive overhead movements. It might also be painful with any sort of movements in which you're bringing the arm across the body. And the reason for that is that particular tendon will become compressed in those particular positions. It'll basically close down that space and compress that particular area. And so a couple of things that can be helpful. One, just like any tendonitis, you can do a self-massage directly on the tendon called frictions. And this can be helpful in terms of breaking down any scar tissue in the area. So a lot of times with a tendonitis, after a few days, you'll get some scar tissue that's placed where the tendon is. And so essentially, you can do a self-massage in which you're going in a perpendicular position to the tendon across the tendon. And again, this can be quite sensitive and painful initially, but as you continue doing that, it should actually numb and help with that particular condition. Another thing as well that can be helpful is actually repeated extensions back, right? So in a lot of cases, again, positions that will provoke it will be across the body or overhead. And in a lot of cases, right, and I've done videos on this exercise before, this extension back, it sort of opens up that space, right? And it also can offload the bicep muscle. Another thing that can be really helpful, especially with more of the acute stages, are some pendulums, essentially where you're just offloading the arm in this position, and postural work, right? So opening up, squeezing those shoulder blades back, opening up that space in the front of the shoulder. So again, in a lot of cases, the positions out in front, right, or this way will provoke, and again, especially initially when it's more of acute positions where we're bringing the arm back or squeezing the arms out backwards can help to typically relieve some of the symptoms. Now initially, once we're past that acute stage of pain, you'll want to actually go ahead and strengthen that muscle. Now you want to be really careful not to do this too soon because in a lot of cases you can provoke the pain as a result of that. If you have any specific questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching and have a great day. Take care.